everyone, I am Jerry Calabrada, a level 1 nursing student from the University of the Visayas. And in this video, I'm going to perform our return demonstration regarding physical assessment from head to toe. So now I will be proceeding to the 9th assessment, which is the abdomen. So before assessing the abdomen, consider the patient's history if he reported abdominal pain. Plan to examine the painful area. Last, if he has a full bladder, have him void to encourage relaxation. During this part of exam, observe the patient's face regularly for signs of pain and guarding. Start by inspecting the abdomen from the ribs to the symphysis pubis. Its contour should be symmetrical to highlight any bulges. Shine a light across the abdomen toward you. No bulges should be visible. Assess the umbilicus, which should be midline and inverted. Next, auscultate the abdomen. Always auscultate the abdomen before percussing and palpating it because these actions make bowel sounds more active than normal. Begin by placing the stethoscope diaphragm lightly on the right lower quadrant because the ileocecal valve in this quadrant. Bowel sounds are usually audible here. Listen for at least 2 minutes. Assess bowel sounds in all 4 quadrants. Determine if the sounds are normal, hyperactive, hypoactive, or absent. Be sure to listen for 5 minutes before concluding that they're absent. Next, auscultate for vascular sounds. By switching off the bell of the stethoscope and listening over the aorta, renal arteries, iliac arteries, and femoral arteries, listen for bruits which may be heard during systole. Bruits are abnormal. Next, percuss in a systematic fashion. You should hear dullness over the solid organs and tympani over the air-filled organs. You may also hear dullness over the distended bladder, adipose tissue, fluid collection, or a mass. You may hear hyporesonance over gas-tended organ. Next, percuss each organ beginning with the liver to assess the liver. Percuss from the right lung area down to mid-clavicular line until you hear dullness. Mark this point, which is the upper border of the liver. It's usually located at the 5th intercostal space. Then percuss up the mid-clavicular line from the umbilical level until you hear dullness. Mark this point too, which indicates the liver lower border. It should be at the right costal margin. Measure the distance between the two marks to estimate the size of the liver, which should be 6 to 12 centimeters. Next, assess the stomach. By percussing over the left upper quadrant, percussion here should produce tympani. Next, have the patient roll into his right side, assess his spleen. So, by percussing from 6th rib down to the mid-axillary line, expect to hear dullness between the 9th and 11th intercostal spaces. Now, percuss at the lowest intercostal space in the anterior axillary line where you should hear tympani. And then, ask the patient to take a deep breath and percuss again, you should still hear tympani. If you suspect the patient has a urinary problem, percuss the bladder, start at the point of 5 centimeters above the symphysis pubis and continue to percuss downward. You should hear tympani over an empty bladder or dullness over a full one. Next, lightly palpate the abdomen, avoiding only the tender areas using your fingertips. Palpate the right lower quadrant and using your fingertips, palpate the right lower quadrant and then move clockwise to all 4 quadrants. Now, switch to deep palpation. Following the same palpation sequence you used for light palpation, push into 5 centimeters. Note the size, location, consistency, and mobility of the abdominal organs. You should detect no tenderness, enlargements, or masses. However, mild tenderness over the sigmoid colon is normal if deep palpation proves difficult, such as an obese patient used by manual palpation. So, to palpate the liver, slide your left hand under the patient, the 11th or 12th rib, and push up upper quadrant and push your fingers down under the right costal margin. Ask the patient to take a deep breath and feel for firm liver to move down with inspiration. Now, try to palpate the gallbladder using the regular technique used for the liver. Normally, the gallbladder isn't palpable if it's enlarged. You'll feel it below the liver. And try to palpate the spleen next. Reach over the patient. Place your left hand behind his back at the 10th or 12th rib and push up. Place your right and just below the left costal margin. As you push your right hand in and up toward the axilla, have the patient take a deep breath. Normally, the spleen is not palpable. If a bladder problem is suspected, you need to assess the bladder. Place both hands in the midline, 2.5 centimeters above the symphysis pubis. Palpate in upward direction until you feel the edge of the bladder, or normal bladder may not be palpable. Next, palpate the right kidney by placing your left hand under the patient's waist below the 12th rib and your right hand directly above it. Tell the patient to take a deep breath and bring your hands together as he does. This is if the kidney is palpable. You should feel a small round mass slide between your fingers. Next, palpate an aortic position by placing your thumb and index left of the midline. Estimate the pulsations with which should be 2.5 to 4 centimeters. Now, test the patient's abdominal superficial reflex. To do this, stroke the handle of the reflex hammer or wooden end of a cotton tip applicator across his abdomen from the side of the midline. Normally, muscles on the stroke side contract and the umbilicus deviates toward the stroke area.